The air quality across southeast Michigan was among the worst in the world today. Only New Delhi, India was worse this morning.
The smoke makes for some hazy orange sunsets. It's kind of pretty at certain points, but it also comes with some serious health risks.
Joining us tonight to discuss the health hazards is Dr. Kathleen Dass from the Michigan Allergy, Asthma Immunology Center. Dr. Dass, thank you so much for joining us tonight.
Thank you for being here.
So what are some of the risks involved here as we breathe this in?
So as we're breathing this in, some people are developing throat irritation, coughing, shortness of breath, wheezing. And this is happening because normally our upper airways are able to filter out these particles, but these particles are so fine that they're actually getting into our lower airways and causing inflammation.
So, of course, anyone with asthma or other respiratory conditions, we know we've been warning them for days to stay inside and really avoid spending too much time outdoors. But Eagle today is saying really everyone should try to limit their time. So what is the danger for those who don't have these conditions?
So even for those who don't have these conditions, you can still develop inflammation. They actually likened the amount of exposure we're having today to smoking 14 cigarettes.
Wow.
So even that can cause some inflammation, even if you don't have a pre-existing condition.
We saw in Philadelphia the Tigers game postponed until tomorrow. The Yankees game in New York, the same, just due to these conditions. For fans sitting outside for, let's say, 3 hours, for professional athletes even playing in it, what can it potentially do to your lungs and do to your system if you're out in that prolonged condition?
So really it's causing this downstream signaling and it's impacting the lining of our lungs, and it's really causing some potential long-term damage. So really if you're going to be outside, obviously the athletes might not be able to do this, but if you have to be outside, an N95 mask would be helpful because it can actually filter out those particles.
And just an N95, not a fabric or a simpler medical mask?
Unfortunately, a cloth mask and a surgical mask are not going to be enough to filter this out.
Could this be long-term? Let's say you are working outside and you are outside for a long period of time. Are there lingering effects when you see something like this, or does it move out of your system pretty quickly and that's the end of it?
It depends on the patient. If you have some underlying conditions, it can last a lot longer. But if you tend to be healthier and have no otherwise health conditions, it should be able to move through quickly.
You know, it's fascinating, kind of shocking that you said it's like 14 cigarettes.
Yes.
How much time do you have to be outside before it's that equivalent? Is it just, you know, when we're walking to and from our cars, is it that dangerous in that short period of time?
It's more of a prolonged exposure, so I would say if you're being outside for hours. But even being outside for a short amount of time right now, I've had more phone calls today than I've had in months just about people's asthma and allergies affecting them.
Wow. So treatment-wise, if you were to have an issue due to this, how would you treat it?
So you definitely want to make sure you have your emergency inhaler if you have an underlying lung condition, but really it depends on what the symptoms are. So I would recommend that anyone who's having symptoms definitely call their medical professional. And for those asthmatics who have the emergency care plan, just make sure that you have your up-to-date inhalers to get through this.
All right. Anything else we need to keep in mind as this air quality alert might be prolonged again?
So I think the most important thing is if you don't have to be outside, please don't go outside. You know, make sure that you are wearing that N95 if you're outside for a prolonged period of time. Make sure your air condition has recirculation so that you're not getting anything from the outside if you don't have to. And maybe avoid mowing the lawn today just to prevent adding that extra particles into the air.
And perhaps keeping those windows closed as
Absolutely.
well. All right.
Absolutely.
Well, Dr. Kathleen Dass, physician with Michigan Allergy, Asthma Immunology Center, thank you so much for being here tonight.
Thank you very much. Thank you.